Hello everyone, welcome to the YouTube channel of Swaminarayan Physiotherapy College. I am Dr. Mahima Raval, working as a lecturer in Swaminarayan Physiotherapy College, and today we will learn about the gait and its kinematics with the terminologies of the gait. So let's start. So what do you mean by the gait? So it is defined as a translatory progression of the body as a whole that is produced by the coordinated rotatory movements of the body segments. So when you walk into the straight direction, that is your translatory progression of the body. And how it is produced? So your body segments, your upper limb and the lower limb rotatory movements that will occur into the coordination to move your body into the forward direction. So that is gait. Now what is the normal gait? So it is characterized by the alternative propulsive and the retropulsive motions of the lower extremity. So when your legs that are taking step into the forward direction, that is your propulsive phase. Okay, and when other leg that is pushing the legs into the ground, okay, into the behind, that is your retropulsive phase. Okay, so when you take the movement of the one foot that will touches the ground, okay, into the forward direction, and at the same time your other leg pushes off the ground behind, that is your retropulsive motion, that is rhythmically movement of your lower extremity, that is called as the normal gait. Then moving towards the gait cycle. So gait cycle, that is the spans two successive events of the same limb, usually the initial contact of the lower extremity with the supportive surface. Okay, so from the movement one foot touches the ground until that same foot that will touches the ground again, that period of the time, that is whole called as the gait cycle. Now we will see the kinematics of the gait. So the kinetics, that is about the forces. Okay, in this video we will cover the kinematics of the gait. Kinetics, that is the ground reaction force, center of the pressure, power, torque and the muscle forces. Okay, that is about the kinetic of the gait. But what do you mean by the kinematics of the gait? So it is about the movements. Okay, when you move forward, that is related to the movements without considering the internal and the external forces that caused the movement, that is your kinematics of the gait. So kinetic, that is all about the forces, that is ground reaction force, center of the pressure, your power, torque and the muscular forces. But kinematics, that is about the movement. So in the gait cycle, each extremity that has the two phases. First one, that is the stance phase. Second one, that is the swing phase. So in detail we will see what is stance phase and the swing phase. So stance phase, that is begins at the instant that one extremity contacts the ground and continues as long as the some portion of the foot is in contact with the ground. So stance phase means when your foot that is in contact with the ground, that is called as the stance phase. And in the gait cycle, it is up to about 60% of the gait cycle. So your stance phase is up to 60% of your gait cycle when your foot that will remain in contact with the ground. Swing phase, that begins as soon as the toe of the one extremity leaves the ground and ceases just before the heel strike or contact of the same extremity when the foot is in not contact with the floor. So when your foot that will leaves the ground and when it is not in contact with the ground, that is called as a swing phase, and it is up to 40% of your gait cycle. So stance phase, that is 60% of the gait cycle, and swing phase, that is 40% of the gait cycle. Stance phase, in that the foot that will remain in contact with the ground, and swing phase when your foot is not in contact with the ground. Then what is another terminology, that is the double support time. So there are two periods of the double support time occurring between the time one limb makes the stance phase and the opposite side is ending its stance phase. Okay, so here in this figure you can see first one and the second one person. Okay, when the one limb, okay, that is starting with the stance phase and another limb that is ending with the stance phase, and the both the limb that is in remain in some contact with the ground, that is your double support phase. Okay, so it is up to 22% of the gait cycle. So stance phase 60%, swing phase 40%, and the double support time, that is 22% of your gait cycle. Okay, now we will see the subdivision of the phases. Okay, we have covered the stance phase and the swing phase. Now in the stance phase there are 5 types of the subdivision. Okay, first one, that is the initial contact, second one, that is the foot flat, then mid stance, heel off, and the toe off. In the swing phase there are 3 phases: acceleration, mid swing, and the deceleration. So in detail we will see according to the terminology all the phases. Okay, so in the gait there are 2 types of the terminology. The first one, that is the traditional method. Okay, in the traditional method the first phase, that is the heel strike, then foot flat, mid stance, heel off, toe off, acceleration, mid swing, and deceleration. So this is called as the traditional method, traditional terminology of the gait, and these are the 8 sub phases of this gait. Okay, second one, that is the RLA method. Now RLA, that is the Ranchos Los Amigos method. So in that the first phase related to the heel strike, that is the initial contact. Second one, that is the loading response related to the foot flat. Third, that is the mid stance, terminal stance, okay, pre-swing, initial swing, mid swing, and the terminal swing. So these are the terminology of the RLA method. Okay, so first we will start with the traditional method and then we will see the RLA method. So in the traditional method, the first phase, that is the heel strike. So heel strike, it is the beginning of the stance phase when your heel, that is comes in contact with the ground. Okay, so in the heel strike, what will be the position of the joint? So ankle will remain into the neutral position. Your knee begins to the flex to absorb the shock. Your hip, that will remain into the 25 degree of the hip flexion. Your trunk, that will rotate it towards the opposite side. So this is the position of the joint during the heel strike. Second, that is the foot flat. So in the foot flat, your foot, that will comes in contact with the ground completely. Okay, so plantar surface of the foot, that is in contact with the ground, and it is about 7% of your gait cycle. In that, the ankle plantar flexes, putting foot on the ground. Your knee, that will partially flexed, that will absorb the shock. Hip, that will move into the extension from the flexion position. Okay, then body, that will catching up the leg, and ipsilateral arm, that will swing forward. So these are the position of the joint into the foot flat. So according to the you have to see the limb, okay, and according to the you have to describe that position of the joint. Third phase, that is the mid stance. Mid stance means the point at which the body passes over the weight bearing leg. Okay, so in this position, in this figure, you can see the right limb that is taking all the weight of the body, and it is up to 30% of the gait cycle. In that, your ankle that will remain into the slightly dorsiflexion, knees and hip continuing the extending position, body that will passes over the right foot, pelvis into the neutral position, and both the arms remains parallel with the body. Then heel off. So in heel off means heel that will leaves the ground, while the ball of the foot and the toes that will remain in contact with the ground, only the heel that will leave the ground. So that is the heel off phase. In that, it is up to 40% of the gait cycle. In the heel off phase, the ankle that will remain slightly into the dorsiflexion, and after that it will begins into the plantar flexion, your knees extending, then beginning into the slightly flexion, your hip hyperextending, pelvis that will rotating backwards and ipsilateral side, and ipsilateral arm swinging forward. So these are the joint position during heel off. Now heel off, after the heel off there is toe off phase. In the toe off phase, the toes that will leaves the ground, and it is up to the 60% of the gait cycle. In that, you can see the limb position, that is ankle into the plantar flexion, knees and hip that will start into the flexion position, lateral pelvic tilt on the right side, and ipsilateral arm that will move forward. So that is toe off phase. So this is about the stance phase of the gait cycle traditional method. In that, we have covered the heel strike, foot flat, mid stance, heel off, and the toe off. So that are the subdivision of the stance phase. Now we are moving towards the swing phase. So in the swing phase, three phases are there. First one, that is the acceleration, second one, that is the mid swing, and the third one, that is the deceleration. In the acceleration, the swinging leg begins to move forward. Okay, so in that, your ankle beginning to the dorsiflex, knees and hip that will continue into the flexion position, leg is behind body but moving forward, pelvis beginning to rotate forward, ipsilateral arm swinging backward. So this is acceleration phase. Then the mid swing phase. In the mid swing phase, the non-weight bearing leg is directly under the body. Okay, so here in this figure you can see your ankle is dorsiflexed, knee at maximum flexion and begins to extend, hip at maximum flexion, pelvis into the neutral position, and arms parallel with the body and moving into the opposite direction. So this is mid swing phase. Last one, that is the deceleration. So deceleration starts when the leg is slowing down in preparation for the next heel strike. So that is the last phase of your traditional method of the gait cycle. In that, the ankle that will continuing moving into the dorsiflexion. You can see the right limb, that is the knees that is extended, knees are extended, your hip moves into the flexion position, leg, you can see the leg that is ahead of your body, pelvis rotated forward, on the ipsilateral side and ipsilateral arm backward and contralateral arm forward. So right arm, you can see it is moving into the backward direction, and opposite arm, that is moving into the forward direction. So that is the deceleration phase, last phase of your gait cycle according to the traditional. Thank you everyone for watching this video. Do like, share and subscribe to Sri Swaminarayan Physiotherapy College Rani YouTube channel.